Could sugar be the new tobacco? Some public health officials say there should be warnings on foods high in sugar, just like there are warnings on packs of cigarettes. WECT's photojournalist Anaya Cromartie takes a closer look into why some doctors are demanding the change.
We see rising rates of diabetes, of heart disease, of cancer, dementia, all linked to a higher consumption of sugar. And these are crippling America.
Some public health officials say sugar and its harmful effects on our health should be spelled out more clearly for consumers. Those officials want to put a warning label on foods that contain high amounts of sugar, similar to the warning labels you would see on packs of cigarettes.
People have to have choice. They have to know what they're eating, and they have to be clear. And I think Americans should have the right to choose what's good or bad for them.
Sugar addiction especially impacts Americans. On average, we eat more than 100 pounds of sugar per person each year. That's more than 3 times the recommended amount by the Food and Drug Administration. And it's not just candy, snacks, and sodas. Hidden sugars in things like processed food, cereal, salad dressing, and even yogurt are adding to our sugar intake. A local dietitian tells us she firmly believes sugar could be just as or even more addictive than drugs.
There's a lot of research out there that shows that. There's a certain combination of sugar, fat, and salt that people cannot resist. So those who I see with the trend of going to eat fast food every day, they truly are addicted.
Kennedy goes on to say 25 to 37 grams is the max amount of sugar we should consume each day. That's where warning labels come in. In the state of New York, as part of the city's Sweet Truth Act, a new rule will require food chains and coffee shops with 15 or more stores in the U.S. to use a warning icon to let consumers know eating too many added sugars can contribute to type 2 diabetes and weight gain. Food industry groups say labels like the ones in New York City will see could demonize certain food products or confuse consumers, and that existing nutrition labels provide enough information for people to make healthy choices. But Dr. Hyman believes having the warning labels would help make the healthy choices that much clearer.
I think people make choices based on what's on the label. They buy low-fat foods. They buy, high-fiber foods.
Anaya Cromartie, WECT News.